Now, this complaint that people often have after gastroenterologists, gastroenteritis, which they call dyspepsia, that they just don't feel good. Oftentimes it leads to irritable bowel syndrome, where they have episodic abdominal pains, and they may be colonic examination with a fiber optic doesn't show ulcers, but the GI tract, you might say, seems to act like it's unhappy. They have spasms of the abdomen. The abdomen may be sort of swollen and bloated. They may have only increased bowel gas or flatus. They may have either diarrhea or constipation, but not the 20 watery, bloody bowel movements a day of inflammatory bowel disease. They just seem to have a gut that is not happy. And they actually can hear noises and bowel spasms as a peristalsis is heard. And these patients frequently have depression, but they don't have the full symptoms of inflammatory bowel disease with the ulcerations of the gut. And this period has been addressed in Lancet, one of the long-term medical journals, and they have an edition that's gastroenterology and hepatology. And here it gives the authors that were from Sweden. And in this paper, he points out that in conclusion that diet has a central role in the treatment of inflammatory bowel disease or dyspepsia. And dietary changes outperform medications for inflammatory bowel disease or dyspepsia. In other words, what you're choosing to eat may give you more benefit than any type of pharmaceutical drug. And he's basing this on 294 patients. And again, 241 were females and 53 males, which emphasizes again that this seems to be a more common problem in females than males, because males' hormonal status is pretty standard through the year, whereas every month in females, their hormones are going up and down, several different ones of them. We won't go into that. But these patients, he gave them 3 treatment groups for 4 weeks. And he had a group on they gave medication to reduce peristalsis, kind of put the bowel to sleep, and fiber if constipation, and they gave them Imodium if they had diarrhea accompanying these symptoms of dyspepsia. And then he gave carbohydrates that were not prone to be fermentable by bacteria. And then he gave a group low carbohydrate diet. And the results, well, the quality of life improved in all the patients. And this is part of what causes confusion in the medical field, is that, and sometimes people think that the physician showing interest in believing the patient is of therapeutic value, that the relationship is important, particularly if the patient believes that the healthcare provider cares about them and believes what they're telling them. So the quality of life improved in all his patients, regardless of what you did. But there was a 76% improvement in those that had low carbohydrate. There was a 58% improvement in those on medications. And with the combination of these foods and carbohydrates, there was a 68% improvement. And unfortunately, 25 to 40% of these patients didn't improve. So you had 75 to 60% that were not improving despite the different therapeutic approaches. But what does help the patients is they found out that those things that the probiotics of yogurt, fermented milk, even fermented cabbage like kimchi, very common in Korea, and the kraut that is fermented from particularly in Germany supports the microbiome of the healthy bacteria, and that helps. And also that the soluble fiber that is common sold over the counter is of benefit. They found out that peppermint oil relaxes smooth muscles of the bowel and kind of sedates the peristalsis and the hyperactivity of the gut that we were saying causes noise, and particularly those that have diarrhea. That's one of the things that found that the cognitive benefit that they had less negative thoughts and behaviors with these things that responded. And they also tried acupuncture and psychology sessions with a counselor. And some of these people will improve, but because it's increasingly known that the function of the brain is the mind, and what the mind believes and thinks is very important and influences through the autonomic nervous system, which is one of the major controls of the gastrointestinal tract. You don't have to think for peristalsis to move your food along the bowel. That's all automatic. And the autonomic nervous system is in two major parts, the sympathetic and the parasympathetic. And the sympathetic turns on genes that are more health promoting and positive activities. These sympathetic activity through the nervous system increases blood pressure, heart rate, sweating, alertness. The parasympathetic slows things down. It decreases heart rate, decreases blood pressure, slows down the secretions of the gastrointestinal tract. And both of these activities are strongly influenced by the activity of the brain or the mind and what you think and believe. And in working with patients time and time again, when they're complaining about their healthcare provider, I will ask him pointedly, do you believe that he knows what your problem is, and that he's giving you his attention and cares what's happened to you? And if they say no, I tell them they need to get another healthcare professional that they believe in, because that's an important part of health status in individuals. Now, in dyspepsia, and the irritable bowel syndrome, these are food groups that are recommended, and we had this FODMAPS, FODMAPS as an acronym that stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols and polyphenols. And these are some of the foods that you see here that they recognize patients that this can be a very important part and can do more for them than different medications by the types of food they eat. And again, I would say that it's very important that this is explained to the patient because what you think and know and believe influences your different organs and particularly the GI tract. So knowing that this has helped people is very important to the individual, is just as much as actually following it. Now, the brain-gut axis of interaction is a significant pattern in inflammatory bowel disease, and the stress and the thinking, thought patterns, idealization can be triggers to cause different problems in the bowel. Personality and human interaction stress is found frequently. They need to be able to cope with their authority and wherever they work, or whether they're teaching or whatever the administration may be. You need a positive relationship there. And especially in couples, there needs to be compatibility and not a constant stress with your partner in life. And the reason for this is because negative thinking patterns are very common in gastrointestinal syndromes, whether it be irritable bowel syndrome, dyspepsia, or ulcerative colitis. And sometimes having patients go to clinic sessions that at specific times that promotes positive thoughts and activities throughout the month can be very beneficial. Again, we're stressing the emotional environment that a person goes through and how that affects your body functions. And one of the GI tract systems is one that's very vulnerable to your emotional environment. And so a corrective diet with professional psychological support can be a successful pattern to help people with irritable bowel syndrome or any type of disease of the bowel. So that's the end of this, and we have tried to stress that diet and your thinking patterns and your ability to cope with your environment are very important in any kind of disease that affects your GI tract, and that the organisms that are in the GI tract are very important in regard to how they influence other organs, and that you need a healthy population of bacteria in your gut. Thank you. If you have any questions, please leave a comment below. If you learned something from this video or found this information helpful, please click the subscribe button to help this channel grow and be available to other people.